Hello everyone. Today's topic is very important because it concerns fertility, it concerns conception. Today we'll be discussing how you can use the mucus sign to discover when you are accurately ovulating and so get pregnant. So because the mucus sign is the discharge that a woman gets, every woman discharges, every single woman have mucus, and the different texture and color that we get for different days of the menstrual cycle depends on the hormones in the woman body that is predominantly in the blood of that woman. And for the first 5 days there is menses, which is reddish in color, and then the other days there is a mucus discharge, which is what we are going to use to predict when a woman is accurately ovulating. So follow me through this journey so that you will find out when to have sex if you are trying to get pregnant.
Generally, every woman discharges from the cervix, and this discharge is called mucus, but the color, texture, or odor of such daily mucus discharge tells a different story. Hello, my name is Joy, and this is Health Tips with Joy, HTWJ. Welcome back to my channel for the old subscribers. For new subscribers, you're highly welcome. Subscribe and click on the notification bell so that you will not miss whenever I post a new video. The knowledge from this video will help you to get pregnant. It can also add to your existing knowledge, which you can use to help a friend later. Topic: the truth about vaginal mucus signs and fertility. How to use mucus discharge to predict ovulation and the most fertile time for a woman to get pregnant.
So, in order to be able to predict your ovulation, there are two main things that you need to do. The first one is to chart your mucus sign. The second one is to use the cycle calendar method, which if you don't know how to calculate, there is no problem, because you can download an app on your phone, on your Android phone, on your Apple phone. You can download an app and use it to chart your mucus sign. So for downloading the app, you can go to your Apple Store. You can go to Apple Store, or if you are using Android, you go to Google Play and you type period calendar, and it will bring out so many apps that is free that you can download and use it to chart your cycle, so that you will know what a cycle means, how to accurately calculate your cycle, because a cycle starts the first day of the menses and the cycle ends a day before the next menses, because the first day of the next menses is the beginning of another cycle. So you don't need to worry yourself about the terminology or how to calculate. The app will ask you certain questions which you will input, and the app will accurately calculate your cycle for you. And for the mucus chart, I'm going to be explaining that in our next part. So come with me.
To chart for the menstrual cycle mucus signs, there are things you should note. The first day of the menses is the first time you should start charting, and then illustrated below also are the colors of the mucus. You can see the textures and also the stretchiness of the mucus. For the colors, there is off-white, creamy or yellow, colorless, and egg white. Remember, the first day of the menses, you are not necessarily seeing a mucus discharge, you are seeing the menses. And the menses is also a type of mucus discharge, but let's call it menses so that we will not get confused. So the first 2, 3, 4, 5 days or 6 days of the cycle is likely the menses, depending on how long the cervical shedding occurs for each different woman. Then after that, we'll experience some dryness. Then from there, we'll experience a hard, sticky, creamy or yellowish mucus. Then from there, it will turn to an off-white, slightly soft mucus, which is non-stretchy. Then from there, it will proceed to off-white, soft mucus that is slightly stretchy until it gets a colorless, egg white mucus that is very stretchy, that doesn't break when you stretch it in between the thumb and the first finger. It stretch very long and it doesn't break while stretching it. That's when you've seen your egg white, and that's the most fertile time for a woman to conceive. So you chart according to your different cycle. You write the month. You can see the month illustrated. There is dates. Then there are mucus signs that you will see. Please note, you should chart before you go to bed at night, because if you chart in the morning, you may have been aroused over the night. Maybe you are sleeping with your partner, or you had sex over the night. What you'll be seeing is not necessarily the mucus sign. It might be a remnant of the sexual activity that happened the previous night. So it's best to chart in the night before going to bed. And while chatting, use tissue or clean hands. Tissue does not really get a very good result because tissue absorbs the moisture of the mucus, but using the hand is the most efficient method. But you need to clean your hands first. You can have a wipes to wipe your hands, or you can use soap and water to wash your hands first, or you can observe your underwear for those that have enough discharge that can be seen on the underwear, because not everybody will see that. Then I'm going to leave the free chatting booklet that I illustrated above, the Excel format, so that you can edit, copy, paste for various months, and you chat so that you can be able to predict when is the most fertile time.
So in this part, I'll be explaining some terms so that when you see it in our next part, you will not be confused. So the first term is menses. Menses is the shedding of the cervical mucus, is the shedding of the cervical wall that occurs after a woman failed to ovulate. So the cervical wall will shed the blood vessels that we are lining there, preparing the cervix for a child, for fertilization to occur, and for it to nurture a child till the child gets implanted in the womb. So if ovulation fails to occur, then there is a shedding of that cervical wall, and this leads to a reddish substance coming out of the vagina, and that is what we call menses. The next term that we will be discussing is pap. Pap mucus. The pap mucus is either creamy in color or off-white like milk, or yellowish in color, and it is thick and hard. It is thick and hard in the sense that when you are touching it, it's not slippery. It's not slippery, it's hard, and when you do your hand like this, it doesn't stretch. And then the last term is egg white. Egg white is that part that you get when you break an egg. You know, the egg has two sides, two parts. You have the egg yolk and the albumin. That albumin part that is colorless, that is transparent and slippery and looks like transparent water, but is slippery and it stretches. That is what we call the egg white. And then there are different texture that you will see with the mucus. You will see hard, you can see soft, you can see slippery, and then different colors. You can see menses, which is red. You can see pap, which is cream or off-white, and you can see egg white, which is colorless. And then there are different degree of stretchiness, whether it stretches at all, or it does not stretch at all, or it stretches and does not break at all. So that when you hear me mention all those terms, you will not be confused, because you will use the nature of the mucus or the color of the mucus to determine which of the mucus that you are getting is when ovulation is occurring.
When you are done doing the mucus cycle chart, and you've already been charting using the calendar method to know the actual cycle, because the calendar method can only give you an average, like a range of days that you will possibly be ovulating, but it will not be exact. That is why the mucus sign tracking is very important, because it will tell you the exact day, the exact time that the ovulation is happening. So you'll be able to superimpose the calendar method tracking with the mucus sign tracking. So you can draw a wheel, a circle wheel, and the circle is basically 1, 2, 3, 4, 5, like illustrated above with a 30-day cycle. So this means that the person saw period on the first day and the next period started on the 31st day. That is why the cycle is 30 days, because that 31st is the beginning of another new cycle. So that 31st is another new cycle. So when the person will draw the wheel, the 1 to 30, that's what you copy from the calendar method app that you downloaded. Then you use your charting mucus chart information, start inputting what you can see. The 1 to 5, maybe that's when the menses occurred. Even if it's just a slight sense of blood that you see on the feet, they see record it as menstruation. Then some people from day 6 to 9 may see dryness, some may not see. Remember, the range I'm calling is not exact. It might just be 2 days of dryness, it can just be 1 day of dryness. So it depends on each woman. It's different for each woman. So you see dryness for some days, then from dryness you progress to seeing a thick, hard discharge that can be creamy or yellowish in color. From that, you proceed to seeing the one that is slightly soft and off-white in color. Then from that, you see one that is very, very soft but still off-white in color. Then from that, as the day goes by, you see the one that is whitish, that colorless. Is colorless. It's like when you break egg, the abdomen part, that egg white part of the egg, not the yolk. When you break egg, you get 2 parts. You get yolk, you get the egg white, which when you cook it, it turns to abdomen. So the egg white part to be colorless like that, is transparent, you can see through it, and it's very soft and sweetly for the texture. And for the stretchiness, when you stretch in between the thumb and the first finger, it stretches and doesn't break. That's when you've seen the egg white, and that's when the ovulation is occurring. Ovulation occurs few minutes to hours immediately after seeing the egg white. That's when the ovulation occurs. And then 2 to 3 days after seeing the egg white, then the person becomes infertile again. So the fertility window is from the time you saw the egg, for a day to 2 days, a day to the time you saw the egg white, 2 to 2 days to 3 days after seeing the egg white. That's the fertility window. So if a woman should have sex in between these 5 days, that's it. A day to seeing the egg white, the day you saw the egg white, and 2 to 3 days after seeing the egg white, the woman will likely conceive. Then from the 5th to 6th day after seeing the egg white, the woman becomes infertile again until the menses occur, and then the new cycle starts. So the time that you have sex, whether it is a day before the egg white or 2 days or 3 days or the day you saw the egg white, will determine the sex of the baby that you have, which I'll be illustrating and explaining more in my next video. So to make this easier, maybe you screenshot the period app cycle track and use the information and cross-check it alongside with the mucus sign chart. Remember, for a woman to get pregnant, the woman has to have sex close to the time of ovulation, during the time of ovulation, or a few days, a day or 2 after ovulation. So whenever you see the color of a mucus that is egg white, the texture is soft and slippery and it is stretchy, then that's when ovulation has occurred. So you need to have sex within that time. And illustrated is a picture showing the different color texture of the mucus that you can see. So I hope this works well for you, because I have used this method and it worked. I was actually taught during my marriage class and I applied it and it worked. Thank you, and until next time.